Diabetes can develop silently, and many people don't recognize the warning signs until it's too late. In this video, we're revealing 10 signs of all types of diabetes that you should never ignore, whether it's type 1, type 2, or gestational diabetes. Knowing these symptoms can help you take action early. Stay tuned, and don't forget to like, subscribe, and hit the bell for more essential health tips. 1. Frequent urination. Your body's cry for help. One of the earliest and most common signs of diabetes is frequent urination, also known as polyuria. When blood sugar levels are too high, your kidneys work overtime to filter and remove the excess glucose from your bloodstream. This extra glucose pulls water with it, leading to more trips to the bathroom, especially at night. If you find yourself waking up multiple times to urinate, it may be a red flag for diabetes. Left unchecked, excessive urination can cause dehydration, making you feel weak and fatigued. This symptom affects both type 1 and type 2 diabetes, as well as gestational diabetes in pregnant women. 2. Excessive thirst. Your body's desperate need for hydration. With all the extra fluid loss from frequent urination, your body becomes dehydrated, triggering extreme thirst. This excessive thirst, known as polydipsia, is your body's way of trying to replace the lost fluids. You may feel like no matter how much water you drink, it's never enough. People with diabetes often experience a dry mouth and a persistent craving for cold drinks. However, drinking more fluids doesn't stop the problem, it only leads to more urination, creating a frustrating cycle. If your thirst is out of control despite drinking plenty of water, it could be a sign that your blood sugar is too high. 3. Unexplained weight loss. When the pounds drop for no reason. Losing weight without trying may sound like a dream, but when it happens unexpectedly, it's a serious warning sign. In type 1 diabetes, the body cannot produce insulin, so it starts breaking down muscle and fat for energy. This rapid weight loss can happen within weeks and is often accompanied by weakness and fatigue. In type 2 diabetes, insulin resistance prevents glucose from entering cells, leading to unintentional weight loss over time. Your body essentially goes into starvation mode, breaking down tissues for energy instead of using sugar from food. If you have a significant weight loss without changing your diet or exercise routine, get your blood sugar levels checked immediately. 4. Extreme fatigue. When even rest doesn't help, diabetes drains your energy, making you feel exhausted no matter how much sleep you get. This fatigue happens because your body isn't properly using glucose for energy. In type 1 diabetes, the lack of insulin prevents glucose from reaching your cells, leaving you feeling weak and sluggish. In type 2 diabetes, insulin resistance makes it difficult for cells to absorb sugar, causing persistent tiredness. High blood sugar levels also lead to dehydration and inflammation, both of which contribute to feeling drained. If you constantly feel wiped out, even after a full night's sleep, it could be a sign of undiagnosed diabetes. 5. Blurred vision. A warning sign from your eyes. Diabetes affects your vision by causing fluid imbalances that swell the lens of your eye, leading to blurry vision. High blood sugar damages the tiny blood vessels in the retina, increasing the risk of diabetic retinopathy, which can cause blindness if left untreated. Blurry vision may come and go, worsening when blood sugar levels are uncontrolled and improving when they stabilize. This symptom affects both type 1 and type 2 diabetics, and in some cases, prediabetes as well. If you're struggling to focus, have double vision, or experience sudden vision changes, don't assume it's just eye strain, get your blood sugar checked. Early intervention can prevent permanent damage to your eyesight. 6. Slow healing wounds. When your body takes too long to repair. If you notice that cuts, bruises, or sores are taking much longer to heal than usual, it could be a sign of diabetes. High blood sugar damages blood vessels and weakens the immune system, slowing down the body's natural healing process. This delayed healing is particularly dangerous for diabetics because even minor wounds can become infected or turn into serious ulcers. Poor circulation further complicates the problem by reducing the flow of oxygen and nutrients to injured areas. Diabetics, especially those with uncontrolled blood sugar, are at risk of developing foot ulcers, which may require amputation if left untreated. 7. Tingling or numbness, a sign of nerve damage. One of the most alarming signs of diabetes is tingling, numbness, or a burning sensation in the hands and feet. This occurs due to diabetic neuropathy, a condition caused by prolonged high blood sugar levels damaging nerves. At first, you might feel occasional tingling or sensitivity, but over time, it can progress to constant numbness and even pain. Nerve damage affects mobility, balance, and coordination, increasing the risk of falls and injuries. This symptom is more common in people with type 2 diabetes, but type 1 diabetics can also develop it over time. If left untreated, neuropathy can lead to severe complications, including infections and foot ulcers. 8. Frequent infections. When your immune system struggles, diabetes weakens the immune system, making it harder for your body to fight off infections. People with high blood sugar levels are more prone to urinary tract infections, skin infections, and gum disease. Yeast infections are also common, as excess sugar in the bloodstream provides a breeding ground for bacteria and fungi. Women with diabetes may experience recurrent vaginal infections, while men may develop skin infections more frequently. Infections tend to be more severe and take longer to heal in diabetics due to poor circulation and a weakened immune response. If you find yourself constantly battling infections, it could be a sign that your blood sugar is out of control. 9. Increased hunger, when your body feels starved. Uncontrolled diabetes often leads to excessive hunger, also known as polyphagia. This happens when your body is unable to properly use glucose for energy, leaving you feeling hungry even after eating a full meal. In type 1 diabetes, the body lacks insulin, causing it to break down fat and muscle for energy, which triggers constant hunger. In type 2 diabetes, insulin resistance prevents cells from absorbing glucose, making the body crave more food in an attempt to compensate. This cycle of hunger and high blood sugar can lead to overeating and weight gain, worsening diabetes symptoms. If you're constantly hungry despite eating regularly, it's a warning sign that shouldn't be ignored. 10. Dark patches on the skin, an early indicator of insulin resistance. Acanthosis nigricans, a condition that causes dark, velvety patches on the skin, is a common sign of insulin resistance. These patches usually appear on the neck, armpits, groin, or elbows, and may feel thick or slightly raised. The presence of acanthosis nigricans often indicates that the body is struggling to process insulin effectively, putting you at high risk for developing type 2 diabetes. This skin condition can sometimes be mistaken for dirt or irritation, but it doesn't wash away or fade easily. If you notice dark patches forming on your skin, especially if you have other diabetes symptoms, it's important to get your blood sugar levels tested. Now that you know the key signs of diabetes, it's important to stay aware and take action if you notice them. Have you or someone you know experienced any of these symptoms? Let us know in the comments. If this video was helpful, be sure to like, subscribe, and turn on notifications so you never miss more important health advice. Thanks for watching, and see you in the next video.